You guys know Dr. Laura. Hey, Dr. Laura.
Hey,
And I want you to introduce you to Patriot Gina. Welcome to the show, Patriot Gina.
thank you. Good to be
I'm
here.
so glad you are here. She is doing so great. She went to see Dr. Laura just like my mom did, and she's got an amazing story to tell, and I want her to tell it. So tell us, Gina, what was going on with you, girlfriend?
Well, it's been 6 years, and I was carrying one of my little granddaughters, and I started having so much pain, but I was already having that pull, and I kept thinking it would get better and get better. So I did decompression for 2.5 years, and little bit of the chiropractic care, but more of the decompression.
Yeah.
And never got the relief I needed. And then went to two neurosurgeons, and so they put me on a prescription drug, which the side effects were not good. And when I did that for 18 months, and as soon as I got off of that, the pain was so much worse. And it was just covering the problem instead of me getting a healing or,
Right.
fixing it. We're just going to
Yes.
cover it up. And then you're going to suffer from, and I've had so many other side effects. And I'm hoping, Dr. Laura keeps telling me, believe it'll get better. It'll get better. And that's what about Dr. Laura is I've been to so many saying the same thing, but she's different.
Right.
She has a good spirit.
Right.
And so encouraging. And I was just gleaning off of her and what she was telling me to keep me going because I wasn't seeing the results like a lot of people were on the first session. And I thought, oh no,
Right.
something's
Right.
wrong.
Right,
Yeah.
right, right.
Uh,
And similar to my mom, it took several sessions, but she did see significant help even after the first couple.
yeah.
Okay. But okay, and you have been on the Freedom Force Battalion, so you heard my story about my mom and Randy and different ones. But okay, your experience was a little bit different. So tell us what happened with you.
Well, I just was determined and we made it's a 600-mile trip. We've got we've got airfare. We've got airline pretty close to where we are, and we've made that trip 5 times. Laura told me at the very beginning, she said, I believe we'll get success between the 14th and the 28th treatment. So
Okay.
just doing what you're doing. And
Right.
well, number 14 went by and there wasn't anything.
You
So
weren't sensing any difference. Yeah. Step down.
maybe a little, but not much. And my
I think
summer, yeah,
your nerves were shot.
literally.
Your nerves were messed up.
She just needs to bathe me in the stuff. But anyway, we got home after our fourth appointment, which was 20 sessions. We were home for about 10 days. And I'd already told myself to start picturing myself the way I want to live
Yes.
instead of reacting to the pain. And there was times that I was seeing myself being hauled to the rest home. I'm not kidding you. I could
No,
hardly walk.
I can't imagine because that kind of pain for 6 years.
Hmm. And then I thought, I'm going to just get a different picture and see myself doing the things that I love to do again. And anyway, we were home about 10 days, and I was here at the house doing my normal stuff. And I'm thinking, where did the pain go?
Wow.
And I was so excited to tell Laura when we come back for the fifth series. I said, I'm so much better.
Just all of a sudden.
Yes,
Yeah.
all of the time. We had a suddenly is what we had.
A good suddenly. A good
A
suddenly.
good,
So
yes,
it was all those, I was talking about your nerve was so frayed and so damaged. And I think that it was being repaired. It took a while for those
yes,
repairs to just to work their way through. So then it could be if you think of like a good electrical cord that doesn't have a bunch of kinks or cuts or whatever in it, and so it can send the right signal. So tell us, Laura, what are your thoughts about what's happened with Geyna?
Well, I'm really excited to have you here, Tina, and the reason why is because you are a very special case. We started working, and first of all, well, your diagnoses were really hard. You had partial herniated disc, bulging disc, and L4, L5, and pain that was trying to be handled, chronic pain for a long period of time, with many different things that you tried over the years with no results. As you know, and as I tell you, most of my patients, when they come, I expect and we expect to start seeing results from early sessions. And that doesn't mean that you're going to feel completely well, but it means that we will start seeing something that gives us hope. In your case, we did see a little bit of relief, but it was minimal. So I did believe that we were moving in the right direction because I saw some response, but it was so minimal again that it was hard to figure out if it will, or how long it will take us to work with.
Right.
So it's been almost a year with in 20 sessions. So it's been in separate times. And every time we take a little bit longer between sessions just to see how you keep doing. But when you were into your 20 session that was months ago, and you had that amazing result, it showed me also that we just need to be consistent. And if we see results at the beginning, if we see something that is letting us know that we're moving in the right direction, we just need to keep going. So thank you for trusting us and for your persistence, because that changed everything, and that gives us all hope. So the fact that you came, this is what excites me the most. You came telling me, like, I want to walk again. I want to be able to walk without pain. Your trips just to see me, I know they were excruciating, because just getting and sitting there for hours, just traveling, was really difficult for you. And I felt it, like I felt that. And, you were just telling me, I want to walk again. I want to just do regular common things that I used to do every day. And in that 20 session, when you came back, now you had a different goal. And that was that now you want to ski because you feel so good. And that's something you used to do and you love. And
that's so amazing to have your life back. That's amazing to do that.
That's what it is about. So I want to thank you, because it's been great working with you this time.
That's very exciting.
Thank
you. Yeah, and I and different things that happened, we just worked through things, and I think that's one of the things about the neural therapy. Everybody make sure to go to prescribinglife.com and go to read about neural therapy, because it's a beautiful art, but it works. It actually works. Instead of masking the pain, like what you were talking about, Geyna, it actually truly restores your nerves, and so that they operate properly and they send the right signals. We've seen people with their chronic pain being gone, their Lyme disease being gone, they're just all kinds of different things. Kay with her what was it called on her face that she had, the palsy?
The Bell's palsy.
Yeah, just so many things. I really think it can help people who just any type of malady that you have, that if you treat that nerve, then it can serve that organ or whatever's not functioning properly and get it to work properly. We've seen with Dana, with her, she was having those weird coughs, and it was from an injury she had years ago, and that has been relieved. I mean, over and over, we're seeing it happen. I really do think, I've got a friend who had a brain injury. I think that I'm going to just talk to her again about going to get some help with that, because that's, made her difficult for her to think clearly. I just think that this could help her. Just so many things that neural therapy can help, and it's just really exciting. We're going into 1,000 years of peace and health, and we're going to have lives back, our health back. We're all now, I never could ski before, so it's not going to make me be able to ski now, but it's going to make us able to get our lives back. Like my mom, you know, going
Right.
on 2 back-to-back cruises, and you know, and not even taking aspirin. And I understand you're not taking any pain medication at all.
No, no pain medication at all.
That
Yeah.
is so
Yeah.
exciting. Well, I didn't want to keep you guys too long. I just want to hear y'all to hear this story, this wonderful news, and it's very exciting to me, and just continues to give us hope that all these, we just share this grassroots. You know, we're not going to get this information from the Biden administration. We're not going to get this information from
No.
Big Pharma and Pfizer. We're going to get this information from each other so that we can get our health back and our lives back. So I'm excited to hear
Yeah.
your story, Gina. I'm glad that you came on to share with everyone.
Well,
And
I want to say,
yeah.
I wanted to say something about Dr. Laura and her office. You know, you always go in with apprehension and worrying about, is this going to hurt? Am I going to get better? And when you walk in, there is just so much peace there
Yeah,
that you just kind of know that you're in the right place at the right
Yes.
time, and that, you know, my steps are ordered of the Lord.
Amen.
Yes.
Amen.
And
Amen.
when I've been there, well, I just kept hearing in my spirit, enjoy the journey. And the people that I've met in that office, the other patients that are going through exactly what we are, it's just, you know, you're in the right place at the right time. And I just am so appreciative of the people there in the office. And then the other patients that I've met has just,
I know.
that's been an encouragement. And I want to encourage others too, because, you know, some are just starting and not getting results right away. And,
Hang in there.
patience is it. Yes.
Right. And it'll work. Just hang in there. And
Hang in there.
especially, and probably the worse off that you were, it might take even farther longer to get you back, you know, going.
Yeah.
But yeah,
Yes.
yeah. Thank you. I love that too. Yeah. It's and it's to look at the whole person. We were talking a little bit before we came on that, you know, sometimes we put stress on ourselves, and that can even cause some pain issues. So it's just the whole person to make sure that you are not, you know, injuring yourself with stress and worry.
Right.
And so there's a you know, I love how Laura looks at us as the whole person, our health, what we're feeding our bodies, all the different things that she's looking at to make sure that our bodies, that she'll fix them, but they'll stay fixed.
Yes, that's right.
All right. I'm so glad to have you come on the show, Gina. I'm going to let everybody go, but I wanted to make sure that you guys heard this story. And don't forget, go to prescribinglife.com and check it out. And also Prescribing Life Telegram, because you can hear several of the testimonials there. And I'll be sure to pop this one on there too. I love you guys. Bye.